Hello everyone! Today, we will discuss how to take care of yourself after wisdom tooth extraction. Ice packs or frozen peas. An ice packs is applied immediately after tooth extraction can effectively reduce swelling and pain. Place it against the cheek for 20 minutes, and take it off for 20 minutes, and can be used 3-4 times on the first day of extraction. Make sure to wrap the ice with a dry cloth to avoid causing frostbite to the skin. Painkiller tablets. Although minimally invasive tooth extraction can reduce swelling and pain, it is still recommended to take pain relief tablet 1-2 days after tooth extraction. Highly recommend to take painkiller before the numbness disappears, because it can take around 60-90 minutes for the painkiller tablets to kick in. It is usually Advil, ibuprofen, 400 to 600 milligrams every 5 to 6 hours. If the Advil alone is not enough, taking both Advil and Tylenol in a specific combination make 200 milligrams Advil and 500 milligrams Tylenol can be taken together for a better analgesic effect with minimal side effects. Note, the goal of using painkillers is to allow patients to manage pain and be able to function during the day. It is not to completely eliminate pain entirely. When pain and discomfort is manageable without painkillers, you may stop taking them. After all, painkillers affect the liver and kidney. Pain is most intensest 12 hours after surgery, and severe pain rarely exceeds 2 days. Hemostasis. After tooth extraction, patients should bite the gauze for 20-30 minutes, and minimize talking for 2 to 3 hours. If there is a small amount of bleeding within 24 hours, it is normal. Only when there is a more continuous bleeding or large black blood clots, should you need to bite the gauze for 30 minutes. Make sure the gauze is moistened slightly. Alternatively, you can choose a moistened tea bag instead. If the bleeding cannot be stopped, you need to contact your dentist. In extremely severe cases, you need to go to the hospital. Avoid causing more bleeding after extraction. Patients should try to avoid actions that cause bleeding. Avoid strenuous or physically demanding activities for 12-24 hours. Avoid using straws and avoid spitting for 12 hours after the surgery. If there is too much saliva, it is recommended to swallow instead of spit it out, or let it drip out the mouth into a sink. Otherwise, the negative pressure caused by using a straw and spitting will disturb the healing side and cause more bleeding. Smokers should avoid smoking within 12 hours after tooth extraction. Food for 12 hours after surgery should be soft and cold, such as ice cream and milkshakes, which can reduce swelling and pain, within 24 hours after surgery. Make sure to drink plenty of liquids, at least 2 liters. Personal oral hygiene. Immediately after the extraction, do not brush the healing extraction site. Only use a toothbrush to brush teeth that are away from the area to avoid irritating the wound. Do not rinse the first day. On the second day of extraction, use warm salt water and rinse your mouth gently. Normal brushing can be resumed 3-4 days after surgery. If appropriate and comfortable, start flossing the teeth around the extraction site. If the patient has difficulty with oral hygiene, he can also rinse his mouth with diluted hydrogen peroxide for a week, 3-4 times a day. Reduce swelling. Post-operative swelling is often caused by soft tissue flaps or bone removal, and it peaks 36-48 hours after surgery. Moderate swelling is normal and healthy because it is the body's way to heal. Everyone reacts differently and worse in the morning than in the evening. Swelling is also related to body positioning. Sleeping with a pillow up can help reduce swelling. Generally, the swelling starts to subside on the 3rd or 4th day after surgery and returns to normal after a week. Increased swelling after 3rd day may imply an infection. On the 2nd day after surgery, do not apply ice or heat. On the 3rd day after surgery, a warm compress can speed up the healing. Examples of warm compress are a warm patch and a plastic bottle containing hot water. Take care to avoid overheating and burning the skin.